Bismillah ar-Rahman ar-Rahim. The title of practical session today is Temporomandibular Joint. Temporomandibular joint receives its name from the two cranial bones which enter into its formation. What are these bones? Temporal bone and mandibular bone. It is closely associated with the role of teeth in the oral cavity. The temporomandibular joint is a synovial bilateral joint that permits the mandible to move as a unit with two functional patterns: gliding movement and hinge movement. gliding movement and hinge movement. hinge movement تخص lower area والgliding movement تخص upper area. طبعا the temporomandibular joint consists of bone and ligament, cartilage, synovial membrane and muscles. فإذا عندنا five components. I repeat: bone, ligament, cartilage, synovial membrane and muscles. The articulating bone parts: mandibular fossa, this is mandibular fossa, okay, of the temporal bone. أيضا we called it glenoid fossa. When I point here, okay. طبعا هي عبارة عن oval depression in the temporal bone just anterior to the auditory canal. هذه هي الglenoid fossa. So when I point here when I ask you to name this, you have to write or must write glenoid fossa. And also there is another bone, we call it, this is the condylar process, or sometimes we called it condyloid process, or mandibular condyle. طبعا هي كلها اسماء لهذه المنطقة. هذا يصير مثل النوب لايك بون wider lateromedially than anterior-posteriorly. okay. منطقة العرض مالته lateromedially أكثر من anterior-posteriorly. It is convex طبعا on all bearing surface although somewhat flattened posteriorly. فإذا هذا الكوندايلر و this is the glenoid fossa. The basic components of the temporomandibular joint include the mandibular component, the head of the condyle, and the disc, and the temporal component, the glenoid fossa, and the articular eminence طبعا اللي هو جزء أيضا من the temporal component, and the capsule surrounding the joint. So we have two hard tissue اللي هم الcondylar والtemporal bone, الglenoid fossa والarticular eminence, and we have two soft tissue, the disc and the capsule. طبعا هذا هو رسم تخطيطي يبين لكم انه هذا الديسك اللي divide the temporomandibular cavity into upper joint space and lower joint space. And this is the condylar head of the mandibular bone, and this is the glenoid fossa. It is part of the temporal bone. طبعا هذا هم diagram يوصف لنا this is the disc, articular disc, this is the temporal bone, and this is the mandibular fossa, and this is the condylar of the mandible. فإذا الارتيكولار ديسك قسم لنا الكافيتي مالت temporomandibular joint إلى upper cavity and lower، أو نسميها upper synovial part and lower synovial part. أوكي. I repeat 4 anatomical parts concerned with the mandibular articulation, mandibular condyle, mandibular fossa, and articular eminence, and the articular disc and the articular capsule. طبعا الارتيكولار eminence هو عبارة عن شنو؟ bony elevation located anterior and posterior to the glenoid fossa or mandibular fossa. فإذا هو bony elevation. anterior to the mandibular fossa, anterior to the mandibular fossa controls the forward movement of the condylar head, while posterior articular eminence, posterior to the mandibular fossa, controls the backward movement of the condylar head. This is the condylar of the mandible, and this is the mandibular fossa. هاي طبعا أهم الأشياء اللي يعني you must know or learn from this video: articular eminence, mandibular fossa, condylar of the mandible, and this is the neck of the condylar, bone. We have what we call capsular ligament. This is the sphenomandibular ligament. And this is the temporomandibular ligament. And this is the stylomandibular ligament. So we have a 3 ligament. Capsular ligament, a synovial capsule which completely surround the condyle, divide into 4 portions: anterior portion, posterior portion, internal portion, and external portion. Temporomandibular ligament. The largest portion act as main suspensory ligament. منو هذا؟ temporomandibular ligament. هذا المين ligament. Sphenomandibular ligament, it is round and cord-like at its origin and takes more of a ribbon-like form at its insertion. هذا هو sphenomandibular ligament. And the stylomandibular ligament, it is distinct from the styloid process of the temporal bone طبعا من هنا from this area, and insert into the posterior border here of the ramus of the mandible. أيضا هنا diagram show you this is the articular disc and mandibular fossa and the condylar bone. The articular disc is very clear here in this section, or what we call meniscus. It is a tough fibrous disc, also known as interarticular disc or interarticular fibrocartilage. طبعا divide the temporomandibular joint into meniscotemporal cavity, this is the meniscotemporal cavity, and also into meniscocondylar cavity. هذا in this area allow a gliding movement. And this is smaller cavity allow hinge movement of the condylar head. Synovial membrane line the internal surface of the meniscus. Synovial fluid lubricates the articulating parts. This is the synovial cavity. All this area surrounded by what we call synovial membrane اللي هو يبطن internal surface of the meniscus. Synovial fluid, what's its function? Lubricate the articulating parts. طبعا ما عدا هذه we have muscles of mastication like masseter muscle and temporalis and internal or medial pterygoid muscles and external or lateral pterygoid. So we have 4 muscles: masseter, temporalis, internal or medial pterygoid and lateral pterygoid. This is the disc of temporal bone. This is the condylar head of the mandibular bone. And this is the glenoid fossa. This is articular disc or intra-articular disc. And all these parts, it is related to the condylar bone. طبعا نبدي بيها من السطحية إلى deeper, from the superficial to deeper, articulating zone, then proliferative zone, fibrocartilage zone, and calcified cartilage and subarticular bone. This is important slide, and all these areas are very important, so focus on this slide. Also, this is important slide. This is the temporal bone, the surface of temporal bone, fibrocartilaginous zone. This is area fibrocartilaginous zone, and this is proliferative zone. When I point here, proliferative zone and articular zone of the glenoid fossa of the temporal bone, okay, and this is the articular disc. Also, this is important slide. Please focus on this slide. This is very important slide. Pay attention here. Articular disc and fibroarticular surface of the condylar and condylar cartilage, and this is endochondral ossification. الاندوكوندرال اوسيفيكيشن اللي يعني بعدها يصير عندنا الكالسيفيكيشن of the bone. Articular disc and fibroarticular surface. This is articular disc. And this is the cartilage. Also this articular disc. أريدكم تركزون على السلايدات اللي قلت إنه مهمة, like this slide, okay, and this slide are important, and this slide. Okay, thank you for your listening. And this slide, okay, this slide, please. These ligaments of the temporomandibular joint, and on this also is important. And this section is important also. Thank you, dear students.